So this is going to be a breastfeeding update along with Kendrick had a lip tie, and we're going to go into detail about what we did for that. So for the last almost 3 months, it'd be 3 months on the 6th, we have been just breastfeeding, no bottles, no nothing. And I noticed that, he was nursing and my nipples would become red and cracked all the time. And then I would get blanching of my nipples. That means your nipples go white. Sometimes when he would come off of me, along with, I believe it's called vasmosis, where you'd get random sharp pain in your breast. That is usually a sign of something's wrong. So I started examining his mouth, and I seen they had a slight lip tie. So I scheduled an appointment with a pediatrician who is also a international board certified lactation consultant. Um, so we went there today, and she looked in his mouth. First look, she said, no, he's lip tied. And he does have a small lip tie, but he's tongue tied. So she thought that it was best to go ahead and clip the tongue tie, and that should alleviate some of the pain at my breast. And so far it has. It's actually helped dramatically. During the procedure, she did not numb his tongue. She said that it's better not to numb the tongue, that being that he's breastfed, that he's less likely to be at risk of an infection, and that has antibodies in it, and that it's going to help with his pain. So that part is actually really good, because when she cut him, she latched him right on right away, and so he only cried for 30 seconds, a minute, if that. It wasn't too long that he cried for. He weighed 13 pounds, 3 ounces today, and he's actually doing really good. They did a nursing weigh with him, and after he nursed for about 5 minutes, and he got the 3 ounces in that 5 minutes. So he's able to get out the breast milk. It's just at my expense, at hurting me. So let's see what else. His schedule, he was pretty set on his schedule. During the day he'd go 2 to 3 hours, and then at night he's going to bed about 8 o'clock and wakes up at 2 in the morning to nurse, and then his schedule repeats the next day about every 2 to 3 hours. Overall, he's doing really well. He's gaining weight perfectly. I don't see no end in sight for breastfeeding. My goal is to make it to a year. If we go a little bit past a year, so be it. I'm not going to have people tell me that I need to stop breastfeeding my son. Granted, I would like for him to be completely weaned off the breast at least by a year and a half, no later. That's my personal choice, and that's my goal. The first 2 weeks of his life, I had pumped breast milk, and so that way my milk would come in pretty fast. So for that 2 weeks that I did pump, I stored 250 extra ounces of breast milk. I was going to donate it to my cousin, but she decided she didn't want it, so it's down in my freezer. So hopefully when he's a little bit older, and starts trying sippy cups and stuff, hopefully he'll get some of that milk in his cup, or he can chew on it, or whatever. I don't ever plan on giving him a bottle. We're doing just breast. I am comfortable with nursing in public. I actually nurse in public all the time without a cover. I do the double shirt method, and I find that way to be rather easy. I haven't had any negative comments towards me. I haven't had any rude looks at me. I haven't had none of that, and so far so good. What else can I think of? Maybe I should fix the camera. Hold on, let me fix the camera. That's the default. That's my good camera too. It's a HD default. There's no way that that's default. I don't know. Okay. Let me think. There's times where he goes a couple days without having a bowel movement, but when he does, watch out because it's nasty in his diaper. He's still in size 1 diapers. I'm gonna guess in the next month or a couple weeks he'll probably be in a size 2. I'm not sure. Right now they fit him perfectly, and I don't see him outgrowing them within the next 2 weeks. I don't. Let me think. I think that's it for the breastfeeding update. I'm going to do a actual update on him once he's 3 months old on the 6th, and also have a baby scale, which I'll weigh him on camera for you guys. Yeah, so I'm going to show you Kendrick. Okay, hold on, I'm going to zoom out. How do I do this? There he is. And there's little chubby cheekies. So, we're going to play cuddle, cuddle, cuddle time. He's not a comfort nurser, which kind of sometimes makes me mad that he doesn't comfort nurse. But it is what it is. So, bye!